The sooner a person receives treatment for a stroke, the less damage is likely to happen. If you suspect you or someone else is having a stroke, phone 999 immediately and ask for an ambulance. There are around 1.3 million stroke survivors in the UK, and your symptoms will depend on the part of your brain affected and the extent of the damage. It is important to keep a healthy diet, as certain foods can have a negative impact on your health. You should also make sure you are consuming a balanced diet, to get all the nutrients your body needs. Indeed, one study presented at the annual meeting of the American Academy of Neurology in 2014 found that 59% of those who had experienced a hemorrhagic stroke were deficient in vitamin C. That group was compared to people who had not experienced a stroke, who tended to have normal levels of vitamin C. A 2012 study also found that people who had lower levels of vitamin D had an increased risk of stroke in comparison to those with higher levels. New COVID variant fears. There are 2 COVID symptoms in fully vaccinated to spot. The National Heart, Lung, and Blood Institute, NLB, says anxiety, depression, and high stress levels are all risk factors. It adds, working long hours and not having much contact with friends, family, or others outside the home are also linked with higher risk of stroke. There are also a number of other risk factors, including unhealthy lifestyle habits, such as not getting regular physical activity, drinking alcohol, and using illegal drugs such as cocaine. Even light to moderate drinking increases blood pressure and the chances of having a stroke, according to a large genetic study in The Lancet. Dementia breakthrough, the daily food to eat that strongly reduces the risk of decline. Arthritis, 4 foods that are big inflammation triggers, how to avoid joint pain. The Stroke Association warned that the catastrophic event occurs every 5 minutes in the UK. Stroke is uncommon in individuals younger than 40. When it does occur, it is often triggered by abnormally high blood pressure. The Mayo Clinic says that aerobic exercise reduces your risk of stroke in many ways. Exercise can lower your blood pressure, increase your levels of good cholesterol, and improve the overall health of your blood vessels and heart. The signs and symptoms of a stroke vary from person to person, but usually begin suddenly. The main stroke symptoms include changes to the face. Your face may have dropped on one side, the person may not be able to smile, or their mouth or eye may have drooped. Signs may also occur on the arms. The person may not be able to lift both arms and keep them there because of weakness or numbness in one arm, says the NHS. Their speech may be slurred or garbled, or the person may not be able to talk at all despite appearing to be awake, and they may also have problems understanding what you're saying to them, adds the health body. The NHS says if you have had an ischemic stroke, a combination of medicines to treat the condition and prevent it happening again is usually recommended. If your blood pressure is too high, you may also be offered medicines to lower it. Strokes can cause weakness or paralysis on one side of the body. If you have had a stroke, your chances of having another one are significantly increased, adds the health body.